I'm here with Bob Radvansky, and he's going to be giving us the latest update on COVID-19. Bob, we see the numbers increasing and getting closer to Palo Alto County. Does this concern you?
Well, to be brutally honest, what's happening is something that we've infection preventionists have suspected for a while, and that's that the disease is here. In the back of our minds, we kind of knew it was here. After seeing the spread in other countries, there's almost no way it wasn't here. The problem was we weren't able to test for it. We had a lot of suspected cases of COVID-19, but now that the testing has become more available, we're seeing a rapid increase in the number of positives. That doesn't mean people are getting sick that fast. These people all were already ill and spreading the disease. We just now know it. So it's concerning because it does unfortunately prove what we suspected all along, and that's that the disease is here. But at this point, we just don't really have enough data or testing kits to find out the full extent.
Okay. And Palo Alto County Hospital is now at a level 4. Can you explain what that means?
Sure. Level 4 is actually kind of unprecedented. We flirted with the idea of going to a level 4 restriction 2 years ago during the very bad influenza season, but never got there. Basically what's happened is all non-emergency services have been suspended. Physical therapy, occupational therapy, cardiac rehab, pulmonary rehab, those departments are all closed to patients coming into the building. We are encouraging them to follow up with their patients any way they can, whether it's telephone or Zoom meeting or Skype, in an effort because we want to keep people healthy during this time. We just can't afford to bring them into the facility because we don't want them to get sick from us. A couple other things that we're doing is all of our visitors are being funneled through our main door. There's only one entrance to the hospital now, and everybody's being screened on entry for symptoms. And if they do have symptoms, they're either asked to go home and self-monitor, or if they have an appointment, we're accommodating that, but we have to move some things around to protect everybody else in the building as well. Surgery, all elective surgeries are suspended. We still will offer emergency surgery and urgent surgery at the discretion of the surgeon. So if you have an appendicitis, we can still take care of that, but you can't get a tummy tuck or any non-essential surgery at this time. Same thing for radiology. We've suspended all non-urgent radiology exams, things that we like to offer to the public, like a peekaboo ultrasound or an ultrasound to find out the gender of your child. Any medically indicated ultrasound will still happen, but the doctor has to make sure that they have rationale for it to bring that person into the facility. All visitors, nobody under the age of 18 can visit the hospital, patients in the hospital, and all patients in the hospital are limited to one designated visitor for the duration of their stay. We know that's harsh. We do have exceptions for childbirth and end-of-life issues. We're not inhuman, but that would be all on a case-by-case basis. Routine visitors, routine hospitalizations, we're just limiting it to one designated person.
Okay. And so why is social distancing so important now?
Yeah, that's one of the things we're trying to do with this level 4 restriction is basically if you don't have a need to be there, don't go there. Stay home as much as possible, limit your exposure to outside entities. Everybody has to go to the grocery store. I totally understand. I shop for my family, so I'm at the grocery store quite a bit. But even then, you want to cover your cough. Not go if you're ill, have somebody else go. Try to stay 6 feet apart. Another thing now that we seem to really be getting into the meat of this problem is home social distancing. It's really important to designate an area of the household that a sick person can stay where other people are at least 6 feet away, and kind of plan on that. Exposure to somebody with a known COVID-19 case with its infectious rate is almost 3 times that of influenza. So we really want people that either suspect or know they have this to try to stay away from other people as much as possible. And in the home, it can be difficult. I know, like I said before, I live in a really small home, but I made a corner of the living room my corner, and I didn't leave it except to go to the bathroom. And my wife and daughter weren't home during the day, and I was fixing lunch. I just wipe everything down and then go back to my corner. But we made it through I was sick with influenza for a week, and we made it through the entire thing, never got sick.
So it works.
It does work. It does work. I know that we keep repeating ourselves, but it can work. It does work, and that's why we suggest it so much.
Okay. And what are we doing here in Palo Alto County for testing of COVID-19? And does saying getting you tested for COVID-19, that doesn't mean that you're positive for COVID-19?
Right, and I think where some of the confusion comes in is the state of Iowa Department of Public Health has issued guidelines as to when we can actually administer a test. The guidelines are meant to test the most vulnerable populations, inpatients, essential workers to the state of Iowa as designated by the governor. And so some of the misconception, I believe, is that people that have actually met the criteria and got tested, it still has to go to the lab. We've actually gotten back negatives. Just because you're tested doesn't mean you're positive. It just means you met the criteria that we were actually able to give you the test. And as more testing equipment and stuff becomes available, we'll be able to test more people. And so hopefully it'll lose that stigma that, just because you did get tested doesn't mean you're positive, you have to wait for results.
Perfect. And where can people go to find out more information on COVID-19?
Our Facebook page right here. I scour the net every day looking for helpful infographics and things that I think would be of interest to people. I forward them to you, you put them on Facebook. We also have links to the Iowa Department of Public Health COVID-19 website and the CDC Center for Disease Control and Prevention website, COVID-19 resource page. Those in the infection prevention world, those are the source. Everything else, whether it's WebMD, any news organization or anything like that, I don't take that as gospel, but from the CDC and Iowa Department of Public Health, that's true and accurate information.
Perfect. And right now at Palo Alto County Health System, we are looking for donations for PPE or personal protective equipment. Bob, what is personal protective equipment and what donations can people give?
Well, if they have them, personal protective equipment is defined as just that. It's equipment designed to protect the user. We're talking about things like exam gloves, surgical masks, N95 masks, which are a higher filtration rate mask than a surgical mask, isolation gowns, all kinds of things that can be used from cleaning supplies, anything.
Perfect. And if you would like to make a donation, if you do have that equipment, you can email PACHS community@mercyhealth.com.